Laryngitis.
So, Assalamualaikum. So, my topic for today is about the laryngitis. So, the laryngitis is an inflammation of the larynx or irritations or infections. So, I will play some short videos about the laryngitis. So, as you can see, this is the normal vocal cords. And this is the acute traumatic laryngitis.
Here is a video showing vocal cords that are very thick, red, and swollen due to inflammation. Note that the vocal quality itself is clear, it just sounds deeper than normal.
And this is the bud vocal cords.
Here are two examples of when the vocal cord does not come together tightly. The first video demonstrates bowed vocal cords, in which the vocal cords are too thinned out. The second shows a paralyzed vocal cord where one of the vocal cord is not moving. Here is a video showing what a small bump on the vocal cord looks like and how it affects the sound. The key thing to observe is that as long as the vocal cord vibration movement is larger than the bump itself, the voice sounds clear. But the moment the bump is in the same size or larger than the vibratory movement, the vibration gets disrupted and a raspy sound comes out. Here are a few examples of pathology affecting the entire vocal cord, causing a raspy sound at all pitch ranges, or even voice loss. Here is a video showing muscle tension dysphonia. Note that the vocal cords themselves appear completely normal. However, when talking, see how the muscles cause the vocal cords to literally become covered up.
So, inside the larynx are your vocal cords. There are two folds of mucous membranes covering the muscles and cartilage. So, in that pictures, so these the inflammations of the larynx. So inflammation of the larynx is most often caused by viral infections. The laryngitis is very often caused by the pathogens that cause the common cold and the laryngitis. So the most common cause is a virus, and laryngitis is often associated with the allergic rhinitis or pharyngitis. So bacterial invasions may be secondary. Then the onset of the infections may be associated with the exposure to the sudden temperature changes. So, and the dietary deficiency, malnutrition, or an immunosuppressed state. And also the viral laryngitis is common in the winter and is easily transmitted to others. So often occurs as a result of voice abuse or exposure to dust, like in that pictures. So, and also were found to be more prevalent among the individuals exposed to the occupational dust, chemicals, smokes, and other pollutants, or as parts of URI. So for the clinical manifestations, so signs of acute laryngitis includes hoarseness, or aphonia. So which is the loss of voice. So in that picture, like in that picture. So this is the partial loss of voice may sound hoarse. So hours. And so this is the complete loss of voice. Sounds like a whisper. So the loss of voice can come on slowly or quickly. So, and the other one is the severe cough. So for the severe cough, like that. So these the severe cases of chronic cough. Chronic cough. So it can cause some vomiting, lightheadedness, and EBS. So most of the coughs go away on their own. So but this severe nighttime coughing may be signs of the serious condition. So for the chronic laryngitis is marked by persistent hoarseness. Other signs of the acute laryngitis includes sudden onset made worse by cold winds. So like in that picture. So for the medical management, so this is the medical management. So management of acute laryngitis includes resting the voice. So like in that pictures. So avoiding irritants including smoking, or drinking some alcoholic drink, or avoiding drinking some caffeine. So and the next one is the resting and inhaling cool steam or an aerosol. So like in that view, so that is in that picture, that is the cool steam and also the aerosol. So if the laryngitis is part of a more extensive respiratory infections caused by the bacteria organisms, or if it is severe, so appropriate antibacterial therapy is instituted. So first is breath moist air. So use a humidifier to keep the air throughout your home or office moist. So or inhale some steam from a bowl of hot water or a hot shower. Then the next one is the rest your voice as much as possible. Like I've said before, avoid talking or singing too loudly for too long. So if you need to speak before the large groups, try to use a microphones or the megaphones. And the next one is the drink plenty of fluids. So this is to prevent the dehydrations and also avoid alcohol and caffeine. So like I've said before. So then the next one is the moisten your throat. So try sucking on lozenges, gargling with salt water, or chewing a piece of gum. So avoiding a decongestants. So these medications can dry out your throat. So and also the last one is the avoid whispering. So this puts even more strain on your voice than normal speech does. So for the nursing management, the nurse must instruct the patient to rest the voice and maintain the humidified environments. So the nurse must instruct the patient to rest their voice. So for the next one is the nurse instruct the patients about the importance of taking prescribed medication. So the nurse must instruct the patient to take the medications. Then the next one is the nurse informs the patients that the symptoms of laryngitis often extended a week to 10 days. So after completions of antibiotic therapy. So like in that pictures. So the next procedure. So the last nursing management is the nurse instruct the patients about signs and symptoms that requires contacting the primary provider. So the nurse must instruct the patients about the symptoms of the laryngitis. So and that's all for the laryngitis.